Hi, my name is Michaela, and this is my case study on patellar tendinopathy. To begin, a quick definition of patellar tendinopathy is that it is a degenerative disease that breaks down the patellar tendon over time. And this type of injury slash disease doesn't necessarily have a mechanism of injury because it happens due to an overload on the tendon, not necessarily a traumatic event on a certain body type. And you'll often hear this referred to as jumper's knee. So you'll see it a lot in basketball players, volleyball players, and tennis players. And the types of treatments that are available for our patellar tendinopathy patients, there's two categories, non-operative and then operative. And a lot of times MRIs are used to assess the amount of damage done to the tendon. And then the non-operative treatments include starting the athlete on rehab, NSAIDs like pain relievers, corticosteroid shots, which help with relieving inflammation, patellar straps, platelet-rich plasma injections, cryotherapy, sclerosing injections, and then of course ceasing activity altogether would be a good option for some athletes, although a sedentary lifestyle could lead to atrophy of the muscles surrounding the knee, which isn't ideal. And then the operative treatment includes having surgery to remove the damaged tissue in and around the knee and on the tendon. Okay. So my patient, he is a male, he's 19 years old, a tennis player, and some of his history, he had his physical exam in August of 2021 and everything came back fine. He was cleared to play. The orthopedist that saw him found no issues with anything. So he started practicing and, he was good to go. But his onset of pain began in November of 2021, which is before I started working with him. I didn't start working with him until January of 2022. And by that time, he had already been in some pain for quite a while. And during the Christmas break in December, he went back home to Japan, and there he saw, I think, 3 of his own doctors that pretty much confirmed that he was suffering from patellar tendinopathy, which is what his athletic trainer and his team doctors had concluded. And in Japan, he also received a corticosteroid shot. And he reported that he didn't have too much relief with that shot, which is unfortunate because, he was about to start playing again. But, from there on, we tried to start him on rehab and try to get him better. So this is kind of his monthly timeline from when I started working with him. In January, when he came back from Christmas break, he was feeling okay, mostly because he had about 3 or 4 weeks off and didn't play much tennis at all at that time. But when he got back, he played in 3 matches in the early season, like preseason matches. He was full go for practice. His weightlifting load was modified through the strength coach, and this is when we began rehab for him. And he also had a mild concussion, which was not related. He got into a car accident and he was out for about 6 days, so that helped a lot because he was resting again. And then in February, he had another major flare-up. Or excuse me, not another major flare-up. He had a major flare-up on February 14th, excuse me. And typically when he would have these kinds of flare-ups, it would make it really difficult for him to walk. He doesn't have a car, so he would walk to and from practice. And some days it was just really hard for him to do that. And he would have to stop like mid practice and just kind of like quit while he was ahead. And in February, he saw the doctor on the 18th, which is when he was prescribed Celebrex for his pain. And then on the 24th, he still wasn't feeling too great, so he stopped play. And the original plan was to be out for about a week, but he only was out for 4 days. He made that decision on his own. So we started progressing him back in to practice on the 28th. And his progression was mainly feeding, which is where he just hits balls to his teammates during practice. It's not something that's extremely heavy on his knees. So we thought that was good for him. And then in March, we continued his progression. We continued his progression and he was getting better. But on the 27th of March, he regressed again and he was out for the next 2 weeks. He was projected to come back on the 28th, but he had a talk with his coaches and decided that, he was done. He was feeling pretty defeated at this time because it seemed like nothing was getting better for him, although we were seeing improvements. He was just kind of down on himself and hard on himself with that kind of stuff. So he's been out ever since, and his rehab continued here and it intensified. And most of his rehab included strengthening exercises. So like lots of squat type mechanisms, single leg squats, RDLs, and he did a lot of hip mobility because his internal rotation wasn't too great. So we wanted to get everything back if we could, like work him back up from the bottom, basically. And we did a lot of manual resistance exercises to keep building up that strength. And part of what me and my preceptor were thinking with this athlete was that he didn't think he was as strong as he is. So a lot of times with the manual resistance exercises, it's me or my preceptor resisting him while he's doing these exercises. And it's extremely hard for us because it's on his lower extremity where he's really, really strong because he's been playing tennis for so long. And we feel it. He is extremely strong, but he just doesn't believe that he's there. And a lot of the times he just doesn't think that he can do certain exercises when we know he can. So a lot of the time during rehab, we have to remind him, like, your body can do this. You may think you can't, but we've seen it happen. Like, we see him do these really, really deep squats during practice and during weights sometimes. And then he comes to rehab and he says, oh, well, I can't do that. Like this isn't good for me. And we're trying to explain to him that this is really good for him. And you just need to continue and believe in yourself and believe in your body, that your body is there to protect you. So that's a lot of the issue we had with him. And then in January and February, when he was still playing and practicing, some of the treatments we tried for him, we did rehab. We implemented the patellar straps on both. Well, at first it was on one knee, his affected knee, which is his right knee. And then he wanted to do it on both knees because every now and then his left knee would feel bad, but the injury is on the right knee. And we're giving him NSAIDs every now and then if the pain was really bad for him. I'm trying to think, let me go back. So PRP platelet, rich plasma. So that brings you to my next slide, actually. So we're in April of 2022. Like I said, my patient is still not practicing or playing, and he talked to his coaches and decided to redshirt, like pursue a medical redshirt because he's done. He didn't really play much in the beginning of the season anyway. And then on April 11th, he went to have an MRI done in hopes of receiving PRP in the future. But when his MRI came back, the results stated that he didn't have any injury. The results came back and everything, the report said that everything was normal, that there was no obvious deformity anywhere, which was extremely puzzling and kind of frustrating as well, because I'm on month 4. My preceptor's on month 5/6 of working with this athlete, trying to get him better. And suddenly we're being told that he's fine. He has no injury. So that was interesting. We're still trying to figure out what exactly is going on with him. We're continuing rehab as usual. I feel like there's not much we can do without a proper diagnosis. And even his doctors that, reviewed his MRI results were stunned. Everyone was a little bit confused because, like I said earlier, he experiences pain so bad that he can't walk, and pain, such pain that he can't practice and he can't lift. So it's a little bit discouraging as well for him and us. He did say that he was a little confused because now he's wondering, is he injured at all? And I mean, it's the end of the season. We're already entering postseason play. So if he's technically not injured, he missed out on an entire season. But it's hard to say that he's not injured when he's in such pain that he can't play. So it was really confusing, really weird, kind of like an anomaly, I guess you could say, almost. But we're trying to get him feeling as good as he can. He still isn't playing, so even after the MRI results came back, and on the 18th, so yesterday, he went back to the doctors, the doctor that ordered the MRI and read his results, and he received another cortisone shot. And while he was at the doctor, his doctor stated that he most likely has fat pad syndrome, which is the inflammation of the fat pad behind the patella. So what we're kind of thinking happened is he did have symptoms of patellar tendinopathy. Excuse me. Is that he did have, that he did have symptoms of patellar tendinopathy, but they cleared up and they got better. And then he started getting worse in a different area. So his fat pad, and a cortisone shot would more than likely help more with his fat pad inflammation than with patellar tendinopathy, because in some of the research articles I read, since patellar tendinopathy isn't inflammation of the patellar tendon, corticosteroids aren't necessarily a good option for treatment. There's a lot of debate on whether it works or not, because corticosteroid shots are meant to decrease the inflammation, and if there's no inflammation to begin with, what is it really helping? So that's the debate on cortisone shots. But I spoke to him today, and he said that his cortisone shot, because it was received laterally in his knee, closer to the fat pad, and he said that he's feeling a lot better, and that in the past with his previous cortisone shots, they didn't really help him. He didn't feel any relief. but this time he is, so like that's a good difference. And it makes sense if his injury switched and like changed, and like it would make sense if it's working now, if it is an inflamed fat pad. Um, but yeah, it was really, really weird. Uh, and we're still trying to work through it. His rehab is still ongoing, and he is still weightlifting with the team. Um, and yeah, let's go to prognosis. Okay, so my patient's condition is ongoing. If it is patellar tendinopathy, for sure, for sure, because this is something that will continue to bother him for the rest of his tennis career and possibly the rest of his life, unless he takes up a very sedentary lifestyle, which I don't see happening for this athlete. Um, and this is a type of disease that doesn't exactly heal with just a few weeks of rest, like if you were to fracture something, or like sprain an ankle. And it's really tough to see where this can go. My time like at this clinical site with tennis is ending soon. The semester's ending. So I really won't be able to keep up with any of the progress he makes from here on out. Um, but I am really hopeful that he finds relief, and I think it's possible for him. Um, it's going to be hard once he begins playing tennis again in the fall, but it's something that he's just going to have to continue to work on and continue rehab with. And thank you so much. That was my case study on patellar tendinopathy.